Low testosterone, also known as low T, can significantly impact various aspects of male sexual health, including ejaculation. Testosterone is a crucial hormone that plays a central role in regulating libido, erectile function, sperm production, and overall sexual performance. Here's how low testosterone affects ejaculation and what can be done to address these issues. Here are some of the impact of low testosterone on ejaculation. Decreased semen volume. Testosterone stimulates the production of semen, the fluid that carries sperm. When testosterone levels are low, the body may produce less semen, resulting in reduced ejaculate volume during orgasm. Delayed or absent ejaculation. Low testosterone can interfere with the neurological and muscular functions needed for ejaculation. Men with low T may experience delayed ejaculation, difficulty reaching climax, or anorgasmia, the inability to ejaculate at all. Reduced orgasm intensity. Some men report that their orgasms feel less intense when their testosterone is low. This can be related to the decrease in semen volume and the weakened muscular contractions during ejaculation. Lowered libido. Testosterone is key to maintaining sexual desire, libido. Men with low testosterone often experience a reduced interest in sex, which can affect arousal and ejaculation. A lack of sexual desire may lead to fewer attempts at sexual activity, further contributing to ejaculation problems. Erectile dysfunction, ED. While testosterone is not the only factor involved in achieving an erection, low levels can make it harder to get and maintain one. Erectile dysfunction can complicate ejaculation issues, as achieving an erection is necessary for a complete sexual experience. Here are some of the many things you can do about it. If low testosterone is affecting ejaculation, several treatments and lifestyle changes can help restore balance. Testosterone replacement therapy, TRT. TRT is one of the most effective medical treatments for men with low testosterone. It involves supplementing the body with synthetic or bioidentical testosterone through injections, patches, gels, or pellets. TRT can help restore libido, improve semen volume, and resolve other symptoms like erectile dysfunction and fatigue. However, TRT comes with potential side effects and should only be done under a doctor's supervision. Medications for erectile dysfunction. Drugs like sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, can help address ED, which may also support normal ejaculation if erection issues are a contributing factor. These medications improve blood flow to the penis, making it easier to achieve and maintain an erection. Clomiphene citrate or HCG therapy. These medications can help stimulate the body's natural production of testosterone without the need for synthetic hormones. Clomiphene citrate is commonly used in men who wish to preserve their fertility since TRT can reduce sperm production. Human chorionic gonadotropin, HCG, mimics the body's luteinizing hormone, boosting the production of testosterone and improving sexual function. Healthy diet and exercise. Lifestyle changes can also have a big impact on testosterone levels. Regular physical exercise, especially strength training, can boost testosterone production. A balanced diet that includes healthy fats, like those found in olive oil, avocados, and fish, lean proteins, and whole grains is also beneficial. Weight loss. Excess body fat, particularly around the abdomen, is linked to lower testosterone levels. Losing weight can naturally increase testosterone and improve symptoms like low libido and poor ejaculation. Obesity is also a risk factor for ED, so weight loss can help in multiple ways. Manage stress and sleep. Chronic stress and lack of sleep can lower testosterone. Reducing stress through relaxation techniques, like mindfulness, yoga, or therapy, and getting 7 to 8 hours of sleep per night can help improve hormone balance and sexual health. Zinc and vitamin D supplementation. Both zinc and vitamin D have been linked to testosterone production. Zinc deficiencies are associated with lower testosterone, so increasing zinc intake through diet or supplements may help. Vitamin D levels should also be checked and corrected if low, as this vitamin is crucial for hormone production. Consult a urologist or endocrinologist. If ejaculation and sexual function are severely affected by low testosterone, it's important to consult with a healthcare provider. A specialist can perform hormone level tests, evaluate the underlying cause of low T, and recommend the best treatment options. When to seek help. If low testosterone symptoms, including issues with ejaculation, are persistent, it's important to seek professional guidance. Your healthcare provider can run tests to determine if low T is the cause and whether hormone replacement therapy or other interventions might be necessary. Addressing low testosterone early can help restore normal sexual function, improve overall health, and enhance quality of life.